Welcome to Better Than Ever Live. Wherever you're watching or wherever you're listening, hope you're making today your masterpiece. In this video, this live stream, today's live show, we're going to talk about cryotherapy. Yes, we're going to talk about standing in those chambers, exposing your body to very cold temperature, why that actually might be good for you, and look at a study to show its effects on injury recovery and exercise recovery. I'm Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, in today's show, like all Better Than Ever lives and every video that I put on social media and my website, I am not giving you medical advice. This is meant for general information and educational purposes only. If you have comments about anything we talk about, whether it's cryotherapy or any of the studies we talk about before the discussion of cryotherapy, leave those in the chat. As always, I'd love for you to give your first name and where you're located along with your comment or question. All right, we got a lot to get to, so I'm not going to chit-chat a little bit, but I want to talk about what's thought to be one of the best eating habits to slow aging. There's a new study that came out in the journal Clinical Nutrition that showed that sticking to the Mediterranean diet could actually help you fight the aging process. Researchers looked at over 4,500 adults, 35 and older, did a questionnaire of all of them, finding out information about their diet and how often they ate certain foods, and then they compared that information to biomarkers in their blood that indicated biological aging. And what they found is the closer their eating habits followed the Mediterranean diet, the less their participants showed biological signs of aging. And we've talked about the Mediterranean diet before. Lots of fruits and vegetables, whole grains, nuts, omega-3 fatty acids, olive oils, things like that. What's interesting is the researchers also found a similar link between participants who were on or adhered to the DASH diet. And this is one we haven't talked about. This is the dietary approaches to stop hypertension, basically a blood pressure diet. And it's not just low salt. It talks about how much to eat from various food groups every day. And what the study seems to suggest is that the reason the DASH diet or the Mediterranean diet seem to help us fight aging is that they are both high or have high levels of polyphenols. Those are the antioxidants found in all kinds of plants that have been shown to have a number of health benefits and protection from things like some cancers, heart disease, diabetes, osteoporosis, and many other medical conditions. Highly processed foods, things in bags, things in boxes, in the frozen food section, canned foods, highly processed foods that I rail against all the time, those cause inflammation and premature aging of cells. Fresh plant-based foods, which are high in polyphenols, fight inflammation and play a role in healthy aging. So I've said it a lot, I'm a big fan of the Mediterranean diet and anything that helps us fight the inflammatory process. All right, another one that I found kind of interesting, there's a new study that shows there's a link between taking a lot of daytime naps and Alzheimer's disease. There's a study of older adults looking at daytime napping and Alzheimer's disease published in Alzheimer's and Dementia, the Journal of the Alzheimer's Association. These were Boston investigators at Brigham and Women's Hospital in Boston, and they found a bidirectional link between daytime napping and cognitive aging. And when I say bidirectional, I mean excessive daytime napping predicted an increased future risk of Alzheimer's, and a diagnosis of Alzheimer's sped up the increase in daytime napping as people got older. And there's a lot of different studies, and Robert, hello, it's good to see you. There's a lot of different studies out there on daytime napping and whether it's good for our brains and good for our mental processes. Some say that daytime naps are good for our mental alertness and our mood and overall cognitive performance, and I am of that camp. My personal anecdotal experience is the rare times I get daytime naps, I feel like I do better from a brain standpoint, but other studies show naps may not be good for our cognitive performance. So in this study, they took people with an average age of just over 80, over 1,000 of them. They wore this device on their wrist to measure their daytime naps. And again, what they found is the more daytime naps the people took, that led to an elevated risk of Alzheimer's disease. But the more that naps increased year over year, that was also a sign of a faster progression of Alzheimer's disease and a deterioration in their clinical progress. So independent of any other risk factors for dementia. And we know that age is a risk factor for dementia. How much you sleep at night is a risk factor. How broken up or fragmented your sleep is. All of those are risk factors for dementia. Longer naps and more frequent daytime naps were an independent risk factor for Alzheimer's disease in otherwise normal older men and women. And the more your naps increased year over year, both in duration and frequency, again, that accelerated the disease process of Alzheimer's. Basically, it was a vicious cycle. The naps led to Alzheimer's and faster Alzheimer's. Alzheimer's led to more naps. It was this never-ending cycle. What's important about this is if you're in your 70s or 80s, or maybe have parents or friends that are in their 70s or 80s, this may be something you monitor and talk to your doctor about over time. If you notice you're taking more naps during the day, longer naps during the day as you get older, maybe you go to a doctor, go to a neurologist, and just see if there's anything to that. This is new research, but I think there's probably something to this. And then the last one I want to talk about, Jamie, I am good. I hope you're doing well up, I think, in Michigan. Very glad to have you. Is it possible to be both overweight and healthy? This is really interesting. There was a study published in the journal Cell, which sounds tons of fun, but it's a great study. Researchers at Arizona State and the University of Virginia basically studied, and what I'm going to skip the methodology of this and kind of get to their summary of what they found, but they feel like, based on study of all these people in their lab, all this stuff that they did, they proposed what they call a weight neutral strategy for treating obesity. And it was based on a number of things they found. Number one, mortality risk associated with obesity is either brought down or eliminated altogether by moderate or high levels of cardiorespiratory fitness, basically aerobic endurance and how physically fit you are, or physical activity. So physical activity and physical fitness pretty much got rid of your mortality risk from being obese. Second, most cardiometabolic risk factors associated with obesity can be improved with exercise, independent of whether or not you lose any weight, and just as much as you would get by losing weight. Also, weight loss that you don't consistently maintain does not lead to a lower mortality risk. Increases in fitness, increases in physical activity, according to their data, were consistently associated with reductions in mortality, much more so than going out and trying to lose weight. Plus, most people that lose weight put it right back on, and that cycling down, up, has a number of different health detriments, bad health outcomes. High blood pressure, better or a worse blood sugar control, worse cholesterol, whereas exercise improves blood sugar, improves blood sugar control, and lowers cholesterol. It's really hard to keep pounds off. People end up in this yo-yo diet cycle type of thing, which is again associated with heart disease, high blood pressure, muscle loss. And so their theory is, don't worry about your weight, worry on getting physically fit. Exercise, it targets that unhealthy visceral fat that we've talked about before. It targets and lowers the risk of heart disease, lowers the risk of stroke, and it's easier to maintain a daily exercise regimen than long-term weight loss. Looking forward to, or not looking forward to tomorrow. She's got a storm advisory. Megan says, okay, glad to see you, Megan. Let's talk about cryotherapy. So this is something that I have cared about for a long time. I was a member of I don't even know what I'd call it, a recovery center that had whole body cryotherapy. It had local cryotherapy, this little cold spray, if you had an injury or something. It had Normatec compression boots, and it had infrared sauna. Had a couple other things, but that was what I was interested in. You paid a monthly fee, and I probably did it for about 12, maybe even 18 months before I realized it was just hard to get up there because their hours were basically when I was working. But I did it, the cryotherapy, at least 2 to 3 times a week. I tried to do it after my workouts, and I'm not going to lie, I actually enjoyed it. I felt great when I got out of it, but I was always curious if it was actually helping me recover from my weightlifting. So that's what I want to talk about today. And there's other forms of cryotherapy. You don't have to stand in the chamber. It can be cold water immersions like polar plunges. It can be ice packs. They've been used for years and years and years to help us recover with fatigue and delayed onset muscle soreness after sports and exercise. And it's been studied in all kinds of studies, all different types of cold, looking at not just delayed onset muscle soreness, but ratings of perceived exertion from the workout, and then blood levels of markers of workouts and muscle damage, creatine kinase and lactate, C-reactive protein and interleukins. And what's thought is with cold therapy, however it's administered, the reason it might be beneficial is because it causes vasoconstriction, tightening the blood vessels, less blood flow gets in there, but also lower inflammatory reactions because of that. So let's see if it actually does that. And I found 3 or 4 studies I want to talk about, but one in particular. But there was a meta-analysis of 27 studies looking at cooling and cold water immersion. So we're not talking about whole body cryotherapy chambers yet, but cold water immersion did seem to affect delayed onset muscle soreness from anywhere from 24 hours to about 96 hours after the workout or after the training. Looking at rates of perceived exertion, how hard you feel like it worked, there was a significant difference in sort of lowering your perceived exertion, but only for about 24 hours compared with the cold group compared to just controls. Now, there was no difference in any levels of any biomarker, the C-reactive proteins, the creatine kinase, and all that kind of good stuff. Those weren't really different. So it was more, again, delayed onset muscle soreness and rates of perceived exertion, more subjective things. But what they concluded was that the cold therapy did reduce delayed onset muscle soreness and lowered the rates of perceived exertion compared to doing nothing. And cold water immersion was the best way to do it. Now, there was another study in the International Journal of Sports Medicine that I found that showed that yes, there actually was, that cryotherapy leads to, with the whole body cryotherapy chambers, leads to improvement in some of the recovery markers, reduced markers of systemic inflammation, lower concentrations of markers for muscle cell damage like the creatine kinase. So they said based on that, yes, it does help us recover from muscle damage, especially when you do multiple exposures on a consistent basis. You're going to have less pain and recovery from painful workouts, less loss of muscle function, less inflammation, and less muscle damage. But it depended very, very much the temperature, how long the sessions were, how often you did them, how in the studies muscle damage was created so that you could test it. So they couldn't really give specific recommendations about those chambers. Another one in that same journal showed that cold water immersion was much better than the whole body cryotherapy chambers that are basically air being blown on your skin. But cold water immersion was especially better was in better performance at the next workout. Jump performance and recovery of that ability to jump after a workout was better with cold water immersion compared to whole body cryotherapy. Now, the one I really want to get to, there was a Cochrane review, which is sort of the gold standard if you're not familiar with medical studies. It's sort of the gold standard as far as scientific studies and reviews of the scientific literature looked at whole body cryotherapy for muscle soreness after exercise. They could not find any evidence that showed that whole body cryotherapy either reduces self-reported muscle soreness, subjective recovery after exercise compared to just rest or no whole body cryotherapy. Now, this was in physically active young males. They didn't have enough data to say whether it was helpful for females or pro athletes, elite athletes. But they said on the good side, there was no evidence that it was dangerous. Now, it's hard to say. That's a big deal because when you expose your body to negative 160 degree temperatures, you worry that there's going to be risks. They didn't find any, but they didn't know if that meant that there just weren't really that many complications from standing in one of those chambers or that they just aren't being reported in the studies. And the last thing I'm going to say about this, because I know this is kind of all over the place, but you need to know what the science says compared to what the marketing schemes at all these places say. Because, I mean, hell, just in Charleston, there've got to be 5, 6, 7 of these cryotherapy places out there. I mean, they're just everywhere. So you might as well know what the studies show right now. And there was a study in 2018 that shows that whole body cryotherapy might actually be harmful for recovery. Looking at people after running a marathon, what they found is that the whole body cryotherapy after a marathon actually had a negative impact on muscle function, negative impact on how you perceive soreness, meaning you felt more sore, and had a negative impact on a number of blood parameters, at least compared to cold water immersion. So this idea that whole body cryotherapy, because it is more tolerable than a polar plunge and ice bath type of thing, which is pretty brutal. Whole body cryotherapy really isn't that bad. You stand in a chamber for 3 minutes, up to 3 minutes. I never thought 3 minutes was hard because you're usually talking to somebody. And yeah, it's cold, but then you just get out and you feel great. So it's much easier, but it doesn't seem like it's any better than cold water immersion if you have access to an ice bath or things like that. And it doesn't seem any better than a placebo, according to this study, in terms of recovery, perceptions of training stress, or any other recovery subjective or objective marker after running a marathon. That suggests that largely when it comes to recovery from sports and exercise, at least according to this study, but there's a lot of people that believe this, that a large amount of people's benefits from it are largely placebo effects. Now, one of the challenges with cryotherapy studies is it's really hard to have a blinded control group. When you do a study, you want to have two groups that everything's the same except for the one variable, but neither group knows which treatment group they're in. Are they in the control, or are they in the treatment group? But if you're getting whole body cryotherapy, you pretty darn well know you're getting cryotherapy. It's cold and you struggle to get through it. I don't know how you randomize that and have people blinded to know what the results or what group they're in, and that makes a lot of these studies hard. Having said that, what I would tell you from a conclusion standpoint, because you can see the studies, some show better, less delayed onset muscle soreness and less perceived exertions. Some show no difference. Some show recovery or biomarkers for muscle damage are lower after cold water therapy, cold water immersion and whole body cryotherapy. Some say no, some say it's actually harmful. So it's really hard to know. What I'd say is try it. And assuming you don't have a medical condition that makes the cryotherapy chambers dangerous, try it for yourself and see how it goes. See if you do it after you lift weights or after you run, and do it some days where you use whole body cryotherapy, use some days where you don't do whole body cryotherapy. See how you feel. See how you feel the next day and 2 days later and 4 days later, and see how that goes. And if you feel like it's making a difference, yeah, maybe it is the placebo effect, or maybe there is a benefit. Now, also with whole body cryotherapy, there are a lot of other theoretical benefits, and the studies are still being done on this, that may make it worthwhile even if it's not as a sports or exercise recovery regimen. Things like, in theory, burning fat and potentially losing weight, because cold exposure, generates or stimulates your metabolism, maybe burn more calories and burn some fat. Cold's thought to activate the brown adipose tissue that again is good for fat loss. It's thought to lower inflammation, and we talked about earlier how big of a deal inflammation is. I'm a big fan of lowering inflammation, so there may be benefits there unrelated to recovery from workouts. But try it for yourself, see how it goes, and basically, and this is not medical advice, but use yourself as a guinea pig. Consider using yourself as a guinea pig and see how it works for you. All right, what do we have? I don't know if that's about the cryotherapy, Megan, but I appreciate that. Yeah, I mean, it's one of those things that it's not for everybody, but I'm a big fan of trying different things. And whether it's the cryotherapy, infrared sauna, compression boots, vibration therapy that we'll talk about next week, there's a lot of different things out there that may be beneficial. The studies are hard to do. The studies are very early, and it's really hard to randomize and blind patients, blind the study leaders and all of that kind of thing. But there's a lot of these modalities out there for recovery from injury, recovery from sports and exercise that we're going to hear more and more about in the coming years. So kind of a little on the frontier of that. All right, that's all I've got for you. If you know people that like health and wellness and recovery from injuries and all that kind of thing, tell them about this channel. There are my social media channels. Have them subscribe to YouTube, especially. It's where I do the Ask Dr. Geier live shows on Friday, and including Anish. That's where I answer injury questions. So join us at noon, 12 p.m. Eastern time on Fridays. That's where I answer medical and injury questions. So, but subscribe to my channel. Click the bell to be notified when I'm on live, because sometimes I just pop on and talk about something and answer questions. So make sure to click the bell so you know, and it tells you when I release a new video as well. If you want to see me as a patient, I get like a lot of requests from people all over the country, sometimes all around the world, because double board certified orthopedic surgeon and sports medicine specialist, but I love to talk about all your treatment options, not just surgery, not just cortisone shots or physical therapy, but all kinds of treatment options, hopefully to avoid surgery. But you kind of need to come and see me in Charleston if I'm actually going to treat you and do treatments or prescribe medications. I can't do that by telehealth, so you have to be in North or South Carolina. But I also do health coaching. So there's a link in the description below that has a link to my website. Go to the upper right corner of the page. You'll see a Work With Me box. Click that. You'll see a contact page. Fill out the form, and we can figure out the best way to work together, whether that's officially as a patient here in Charleston, South Carolina, or just a coaching video call session. Also, make sure if you can't be here Tuesday, Thursday, 5 p.m. Eastern time live and participate, make sure to subscribe to the podcast wherever you get your podcast, Better Than Ever Live, so that you can listen to it on the way to work or home from work or at the gym or wherever you do that kind of thing. Thank you so much. This was a lot of fun, a topic I really wanted to talk about. Thursday, we are going to talk about a really hot peptide for those of you that know a little bit about peptides, and we'll talk about that overall, what peptides are on Thursday, but a really hot one in the weight loss world, but also the theoretical benefit of better athletic performance. We're going to talk about MOT-SC. So join us Thursday afternoon, and we're going to talk about what that is, who uses it, why potentially someone might use it, pros, cons, all that kind of stuff. We'll talk about MOT-SC on Thursday. Thank you so much for joining you. I will see you Thursday, 5 p.m. Eastern, and if you missed that, I will see you Friday at noon for Ask Dr. Geier.